back to Adoption and Beyond. I'm Elise White, Social Service Program Manager at Adoptions from the Heart and the co-host of this podcast.
And I'm Nicole Fowler, Director of Social Services at AFDH and the other co-host of this podcast. Today, we are exploring a topic that impacts so many, yet is still surrounded by silence and stigma: fertility struggles. We will be discussing both the personal and professional sides of this journey, especially through the lens of those who help others navigate it every day.
Yes, today we're honored to be joined by an incredible guest, Dr. Nancy Grechko, a licensed clinical psychologist specializing in women's health and also the founder of Grechko Training and Consulting. Dr. Grechko brings years of clinical experience, consultation, and training, all rooted in a holistic, research-informed approach. She's passionate about making complex clinical concepts practical and empowering for both clinicians and clients.
Dr. Greco brings a wealth of knowledge and heart to today's conversation. We'll hear about her professional work in fertility counseling, but also her personal journey, giving us an intimate look at what it means to walk through and support others in the complex world of reproductive challenges.
If you're a professional in the field, someone experiencing fertility challenges yourself, or just looking to better understand the many layers of this experience, this is a conversation you won't want to miss. Time to go into our What's Buzzing segment. Myra, what do you have for us today?
Thank you, Elise. So today I want to talk to you guys about the new Hulu show called Good American Family. Have you guys heard of it?
But Nicole, I believe you have a little bit.
Yes, I had read a lot of different histories of the show, and from my understanding, the show has really aligned with what we do know, what we don't know, because there are so many things that we do and don't know here.
Definitely, I agree. I mean, I want us to focus on the show, not on like anything the outside things that people may be talking about or the other interviews. There has been other documentaries and things that show both sides, but I want to just focus on the show and what they're showing us from the show. For those who don't know, Good American Family is out on Hulu and it is inspired by a dramatic but real story of Natalia Grace, who lives with a rare form of dwarfism. And in 2012, her adoptive parents said Grace was an adult who was posing as a child and had her age legally changed. This series examines why scrutiny grew on Grace's age and identity. So I'll go over a little bit on what the show is about for those who don't know. The mom specifically is portrayed in the show as like wanting to save the kids type of person. Like she had her first child is autistic and she wrote a book about his experience, and he is shown as like this genius kid, although they have told her that like he wasn't going to be good and that he wasn't going to do well, and he was able to like exceed expectations in all of these things. So at the beginning of the show, it shows a lot of like her being great, and they like paint Natalia as like this like almost demon child that like comes in with a knife and it's like trying to like scare the mom and all these things. But then like there's an episode 5 specifically was the episode where like they show a little bit more or of her side. So at this point all we really know is like Natalia came. They don't know if Natalia is 8 years old or if she's an adult. So because of her dwarfism, she looks very young, but then she has like pubic hair and she has a period. So they're not sure like what's happening. So then they go and change legally her age to be 22 years old after the mom like pushes for her to go to different doctors appointments and all these things. Because she has dwarfism, she has a disability. She is then left after she's changed her age. She's left into this apartment and they just leave her with like no help at all. So she's like, even if she is 22 years old, like she's left into an apartment where there is no, like she can't open the faucet to shower. She can't open a can, like they left her with food, but like everything is told. She can't reach anything, so she can't eat. She can't use a can opener. She can't use a lot of the things in her house because there are no help at all for her disability. So my question for you guys is, in Good American Family, we witnessed the Barnett's decision to legally change Natalia's age from 8 to 22, and then they leave her in her apartment that wasn't equipped for her needs. This raises the questions about motivations. Do you think this reflects a savior complex that turned into abandonment when the reality didn't match this family's expectations? How do you think that this portrayal challenges our understanding of ethical responsibilities in adoption, specifically concerning children with disabilities? And I know this is a big question. So, feel free to answer part of it, all of it, whatever you guys think.
Definitely. Thank you, Myra, for the explanation around the show and true story here. So I had mixed feelings about the show and reading about everything because, like, here we are with a trope of international adoption and disabilities and the challenges that come with that. But it's so important to tell the true stories too of um, people who are way out of their bounds on not educating themselves about what it is like to A, adopt, B, adopt an older child, C, adopt a child with disabilities. And that is going to come with, I mean, parenthood in general, no matter how you build your family, comes with a huge responsibility. This is even more with this child, I believe, had been in a disrupted placement before. So this has already been through more trauma than we would ever even understand. And so it's hard to see these things working in the adoption community because of, like, it feels like, okay, here we are again with a trope around adoption, but it is true and it happens. And that's why we have to talk about it. And like you said, Myra, whether Natalia was 8 or 22, it doesn't matter. You were committing your life to be her parents and set her up for success, whether that was in your home or not. And not setting her up for success in a home with her disabilities is, no matter what happened, is just irresponsible. It shows what the true intentions were behind the starting of the adoption process and the true lack of education and care surrounding what this all really means. So it's a little bit of my jumbled thoughts there.
Yeah, I mean, I can't speak to the show because I haven't seen it and I'm not well educated on this story. I think it's just important to remember that adoption comes with unknowns. And while this sounds like an extreme, of course, example. There are a lot of unknowns with adoption, a lot of factors that are out of your control, and those only multiply when you, like Nicole said, are adopting an older child, and then when you are adopting a child with, a different ability. So I think that, like Nicole said, there was obviously a lack of education because when you are adopting a child, specifically an older child with any different abilities, there are so many layers to that. And it sounds at least like there was no preparation for the potential issues that could arise with that placement, regardless of this individual's age. All of the behavioral things that may have arisen, like all of those things could have been completely normal for a person affected by trauma or loss. And obviously, there was not enough education. And so again, not being able to speak so much to the story, but just adoption in general and reminding people that there are unknowns, there are a lot of factors, and that's why a lot of education is required and needed before, jumping in with 2 feet.
Thank you guys. I completely agree. I also agree, Nicole, with like seeing shows like this. I was like, oh my God, why not another? Like, why is this the story that they choose? But it was heartbreaking to see. And it was also seeing, I didn't want to get into this, but also like the agency that they worked with was not ethical in any way. And it actually like disappeared at some point. So like that is also like play a part on that of like not having any education or preparation for this in any side. Like the parents didn't do their due diligence to do their own education, but also the agency did not provide any education for them either. So yeah, well, thank you guys for your insight on this, and we can move on to our conversation.
So, Nancy, thank you so much for being here today with us to talk a little bit more about everything that you do.
Thank you for having me. I'm so happy to have this discussion with you today.
I would love to know if you don't mind, as a starting point, sharing a little bit about your own personal journey with infertility, how it kind of shaped the way you show up for your clients in your professional work.
Yes, my journey is quite a long one, but the short version is that I knew I was going to struggle with fertility. I knew that that was going to be a challenge for me based on my medical history. So I was prepared for that. And as life would have it, I became pregnant unexpectedly. I had been married for about a year. So, it wasn't unwelcome, but it was a surprise given that I was told it was going to be a challenge. So the challenges really came afterwards. I am one who struggled with secondary infertility, which is also not something that a lot of folks speak about. They don't share that experience. There's a lot of whether it's shame or insecurity or there's a lot of duality here. There are a lot of dialectics because we love the family that we have and we know that there's more. There's someone missing at the table, so to speak. And no two fertility journeys are the same. So I think it's important to share that because my journey was a little non-traditional, so to speak, if there's anything traditional about fertility and fertility challenges. And the way that it impacts how I show up for my clients and just in life is just the depth of the understanding and the empathy and the authenticity. Because unless you've been through it, it's really hard to tap into that in the therapy space. And that's not to say that we need to live through every experience that our clients have, but it certainly adds some richness to it. I know what it feels like to have that hope and that despair at the same time. I know what it's like to, be brought down to my knees by this challenge. I mean, like most people, I've been through some adversity, but nothing has brought me to my knees like struggling with fertility. And I can own that and I can sit with that. And that allows me to come in this space authentically and share, I get it. Now, I don't go too deep into that because it's not about me in this space. And just knowing that the person sitting across from you, whether it's a virtual space or an in-person space, to know that they understand really does make a difference. So it allows me to show up in that way.
Have you found it at all to be a challenge as somebody who's personally experienced infertility to also then help counsel? Is there ever a time where you start reliving those feelings? Is that ever a stressor for you, or is that something you kind of had to work through first?
Both, all
Mhm.
of it. We're human. So even if we do our work, that's going to become activated in this space. So I know what it's like to think that you're pregnant and you're not, or to be pregnant and then you're not. I know what it's like to be told this isn't going to happen for you in the way that you envisioned, and you need medical assistance. I went through IVF. I also know what it's like to, just hope beyond hope and also feel that despair, to lean on my partner and also feel so isolated. And that can become activated within the therapy process. And it just allowing that pause to have to, sit with that and come back to the moment, right? I'm going to be human. I'm going to have my emotions. And my goal, my purpose right here, right now is to be with my client. I can share my experience with boundaries and limits, of course, and come back to this moment. So there are challenges, and it may be that I know, okay, this is going on a shelf for now, and I need to take care of myself later. That's really important to come back to it and to honor that and to process that, because left unprocessed, that accumulates over time and it can wear us down, especially in the fertility space when we're talking about reproductive health, because, something that I think most people struggle with when they're struggling with fertility challenges is that this will forever be a part of your story, regardless of how it ends, whether you have that baby in your arms or you don't, it's always going to be a part of your journey. So it's not like, oh, well, you had your baby or, that part of your life is over. It's always going to come back to the surface in one way or another.
Thank you so much for sharing all of that. I think in our space, when we're evaluating families too, not counseling, we're evaluating families for
Mhm.
adoption and things like that. We come with our own experiences. We have a lot of members of the adoption triad who are now evaluating families for adoption and taking it. I love your advice of, we have to recognize that we're human and that these things may come up, but to take your advice to take a pause and recognize that you might need to do that later, and the balance between sharing and also just letting the client have their experience as well. So that really speaks to us here, and I really appreciate you sharing that. Can you tell us some of the biggest misconceptions that you encounter about fertility, either from clients or within the mental health field?
Sure. And the first would be the word infertility. So the word infertility is a challenge in our community because it's so final. Like, you are infertile. And that's not usually the case. We're dealing with suboptimal fertility, commonly what we refer to as fertility challenges, right? Rather than infertility, because many of us, we just need some support. It doesn't, there are many ways to enter into parenthood, and there are many ways to grow your family, to expand your family, to start your family, and it's going to look a little different. For many of us, we just need more support, whether that's medically assisted or other avenues towards parenthood, but the kind of misnomer of infertility. We are struggling with fertility challenges, and that could be a larger discussion about how medical jargon can be really pejorative or kind of punitive or judgmental at times, especially when we're speaking of women or people assigned female at birth, where the language can be a challenge. But that I say would be the first misconception, is that people are infertile. And it's really suboptimal fertility, whether there are things that you can naturally do to support fertility or you're going to need medical intervention. Other, I would say, biggest misconception, I'll say two more, is that if there is a male partner, if there is a partner involved, that they're unaffected. A lot of times, if you do get any support in terms of your mental health, in terms of your emotional well-being, it is focused on the person undergoing treatments or, who's struggling with those fertility challenges. So when I did get support in my own journey, folks would say, well, how are you doing? How are you processing this? I don't think anybody went to my husband and say, hey man, how are you dealing with this? This must be a lot. What is this like for you? I don't think anybody ever asked him. And it absolutely affected him. And I would say with even more layers, because he's struggling. Is it me? Is it something I'm doing wrong? Is there something in my body? Is it on my end? Like, there's also this question of like, who's to blame, so to speak, like whose fault is it? And that's not helpful. But also, how can I better support my wife? Like, I'm helpless in this situation. And especially with how men are socialized in toxic masculinity, to feel helpless will absolutely affect a partner's mental health, right? Because there is not much he could do for me, right? There are a lot of things that he could do to support me, and then others that just were, sometimes just what I say, sitting in the suck, like you just kind of have to sit in it. So that's another big misconception, is that our partners also need support. And the third misconception is that mental health providers, and even any kind of healthcare providers, know how to do it, how to manage someone's emotional or overall mental health well-being when it comes to fertility challenges, when it comes to reproductive mental health. We do not. Not everyone has the training, has the knowledge, has the skills base. So it's important to find the right provider. Not every therapist can support you in the way that you need. And that's okay. But that's a huge challenge, in that we don't have this training.
Thank you for educating us on all those topics, but also more positive language. That's something that we strive for in the adoption community all of the time. What's more positive adoption language that we can be
Mhm.
using? Because historically it is negative, and it sounds like it's the same in this space, right? So being able to say fertility challenges rather than infertility is impactful. And so we appreciate that knowledge, certainly. I'm curious because you talk about, and I think it's so true, often if there is a male partner, most people are not necessarily checking in on him, right? Or whether it's a male partner or not, they're typically checking in on the individual that's experiencing physically the losses, right?
Mhm.
Or the challenges. Can you talk a little bit about how, what that emotional toll of fertility challenges really looks like, on the toll it might take on a relationship, and how you can help people maybe navigate that space a little bit?
A lot of people will say when you're struggling with fertility, it can make or break you, however that sits with you, whatever that means to you. And I find that to be true. Luckily, my husband and I came towards one another. We leaned on each other, but I can absolutely see, and I do see, how this can destroy relationships. Even the very act of trying to conceive becomes, methodical, it becomes strategic. It takes that spontaneity and that fun and that playfulness out of it. So that's going to affect the partnership. Also, the constant checking and the obsessing. For some people, they have different ways to manage stress. So for some people, they need to go outwards and they need to talk about it and process. And now, what if your partner is not that external processor? They're more the internalizer. They're in their heads. Well, now it's going to feel like your needs are not matched. Your needs, because they're not, and that your needs are not met. It may seem like your partner is uncaring, when really they're just processing in a different way. Thankfully, my husband and I have similar styles. We go inwards, And then when we're ready to process, then we will process outwards. So we're able to understand that about each other. But this can cause a lot of friction. It can cause a lot of opportunity for growth within the partnership. So there's no right or wrong. It's just, how can we work through this? We're on the same team. We are on the same team. And that's a huge challenge because, when I see one partner going inwards, another partner going inwards, but they're just creating more distance, they're not coming to each other to process together, that becomes a big challenge and a lot of misunderstandings and judgments or mind reading that can lead to bigger problems down the line. And for, we'll say, a female partner who's undergoing the testing and the procedures and all of that, it can feel very lonely, very, very lonely. And, again, I think from the perspective of a male partner, that helplessness of not being able to fix it, not being able to do anything about it. Especially for male partners who, let's say, there are medical challenges on their end. That's going to be another layer to that. Maybe they don't feel like they have the right to be upset because I'm not going through, the treatments. I'm not the one doing all, like, there's guilt, there's shame, there's all of it. There's so many layers to it. And even outside of, a partnership, a romantic relationship, it affects all of your relationships. Your friendships, you want to talk about it, you don't know if you can talk about it. Are people sick of you talking about it? Do they really get it? And, my concern would be when we stop reaching out. When you are someone who normally reaches out, you want to be supported, and you start going inwards, you start isolating, it can affect all of these relationships. And also for folks who are providing you unsolicited advice or just don't think about it, don't worry about it. I had, so many people say, have you tried this? Have you tried that? Listen, I've tried it all. I don't tell someone who's going through fertility challenges to try something, because we have Googled for hours, for days, every single month to optimize fertility, to increase chances of conception. If someone had told me to dance under the moonlight with flower, like covered in flowers with a Billy Joel song, like, I would have done it. I would have done anything. And it's not always helpful, But just, I remember a medical provider was like, "Oh, honey, don't worry about it. Don't worry about it. Go on vacation, relax, and it'll happen." Boom. Okay. Like, it affects all of our relationships. It affects how we show up in relationships. So it really affects all of our relationships, even outside of any partnerships that we may be in. It affects all aspects of your life for many of us.
Absolutely. Growing a family is such a huge part of the human experience if that's what families choose to do. And we definitely see a lot of similarities there. And my advice for family and friends, for people going through the adoption process, is to ask the person what they need. How can I be here to support you? How can I be here to help you? Is that checking in, asking questions weekly, or is that not bringing it up and you bring it up when you're ready? But please know that I'm still thinking of you. I'm just trying to respect what would work best. And I'm curious, do you do couple counseling or family counseling at all?
I do not. So within my practice, that's another piece from my doctoral training that, we didn't have a whole lot of in terms of couples work and families work. So I would refer out for that. We have wonderful providers who specialize not only in reproductive health, but in couples and families. And, my hat's off to them, because that is some deep and very impactful work that they're doing.
I appreciate the openness around the conversation of having that education and that there's so many different parts to all of this. It is time for our Ask Anything segment. Myra, do you have any questions from our audience?
Hey, Nicole.
Hi.
Yes, I do have a question from our audience. So this one came from someone named Alexa, and Alexa says, "My partner and I keep saying maybe one more round of fertility treatment, but we're both exhausted and emotionally and financially. How do couples actually know when it's time to hit pause on fertility treatments and start seriously looking if adoption can be an option for them?"
That's such a tough question because it's so personal and it differs for everybody. But I think when you hit a point where you're starting to question, is this worth it? Is this really the path that makes the most sense for us? That's a great time to start looking into other options and kind of hit that pause button and maybe just give yourself a time and space to do nothing and not focus on your fertility struggles for a month or 2 months or 3 months, whatever it might be for you, and give yourself a time to reset and not be the whole focus because as if you've ever been through any fertility struggles, it becomes all consuming. And that takes an emotional toll, of course, physical, of course, financial as well. And sometimes the best thing you can do for your own mental health is to just take a step back and say, we're just going to enjoy our life as it is right now and hold space for us to focus on everything else that we have going on instead. Nicole, what do you think?
I think that was said perfectly, and how all-encompassing that is. And I know they mentioned being emotionally and financially exhausted, but I'm sure physically exhausted as well, which can impact, as Dr. Grechko was saying, your nervous system, all sorts of different systems in our body that are already on overdrive. So I like what you said, Elise, about taking a pause, but I know that that can feel like possibly like then it's never going to happen. And we here believe in options counseling for both expectant parents and for prospective parents through any means, and searching different options and maybe taking a pause to say, this is going to happen for us. We just don't know how right now, and maybe take that time to explore what that looks like for your family. And we believe that any option is okay, and you have to figure out what works best for your family. If you do choose adoption, there are so many different ways to go about it, and so many different avenues, agencies, public, private, so much research. Don't jump into that immediately, because it can send you over the edge of just being like, this is never going to happen for us. So taking that time to really do your research of what works best for your family if you do choose to move forward with adoption. But we believe that everybody is going to be there at a unique time in their lives. And so we respect that each family is going to be different for when they want to explore that. And we don't want grief of fertility struggles may be there forever and something that you're going through no matter what. But we definitely think it's best for growing a family through adoption if adoption becomes plan A eventually. There's no time frame for that. That's what works for you. So reach out to family and friends, be with your support systems, find a community. You're not alone, as Dr. Grechko said, but also take time to be by yourselves and explore your options. And we're here if you're ready to talk about what adoption looks like.
Thank you so much for your answer, and we will get back to our conversation.
Can you tell us a little bit about how you approach counseling clients who are dealing with the grief and uncertainty of fertility challenges, especially when hope and loss can coexist?
Absolutely. So it's holding that dialectic. So I am trained in dialectical behavioral therapy. So it's all about, two seemingly opposing truths can be true at the same time. So hope and loss, hope and despair. All of that is true. And it's a very confusing time when you're struggling with fertility, when you are, planning a family and it's not exactly matching your timeline or what you thought it was going to look like. And holding all of that, all of it is valid. So when I am meeting with someone, we can hold all of that. We can sit with it. We can process it as much or as little as you want. And we're always going to work on nervous system regulation, regulating the nervous system, because when we are struggling with fertility, when we are, I'm just going to say it plainly, obsessing, because it can become something that is very consuming, the nervous system is dysregulated. We are on high alert. We are feeling every single twinge in our bodies. We are, hoping and praying during that 2-week wait. We feel that complete despair when we find out we're not pregnant, or when we go through a loss. And it's a very secretive process as well. It's a very lonely process. There's a lot of shame there as well, and multiple layers to that shame. So that nervous system regulation is really important, because we are going highs and lows, highs and lows. We are in high alert. That chronic stress is absolutely going to impact us emotionally, physically, all of it. And because life is life, because we're humans, fertility is not our only job. Fertility is not the only thing that we're doing. You still have a job. You may have other children to raise. You have a partner who supports you. Maybe you're caring for aging parents. There's so many roles that you play that fertility isn't even all of it. It may feel like it. It's going to seep into all these other areas, and it's not the only thing. So how can we regulate the nervous system so that you can move through your day with a little bit more ease, And so that when these things happen, when you feel that despair, when you feel that discouragement, that shame, that you don't stay there for too long.
Yeah, I love that you talk about, that this is not our only job. We're out here still living our everyday life while having all of these experiences that a lot of people don't know. I mean, we have clients that share with us stories of, actively experiencing miscarriage and sitting in their office and still having to work, and people around them don't know what's going on. And, I'm curious your thoughts on cultural and societal expectations around parenthood and around growing a family and the impact that that can have on folks who are experiencing these challenges.
Mhm. So there are many layers in terms of societal expectations. And we'll say, women who are trying to conceive, that it should be easy, that this is what you're biologically meant to do. And that if it doesn't go as planned, if it's not easy, then there's something fundamentally wrong with you. Now, we know that is not true, right? And thankfully, in my experience, I didn't experience that. I had a pretty non-judgmental understanding of, yes, technically the fertility challenges were on my side. It was all on me, whether it was age, my thyroid concern, endometriosis, low egg quality. I mean, boom, 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 all the way down the list. And I was like, okay, well, those are medical problems, right? Like those are medical challenges. Not there's nothing wrong with me as a human being. It's not like I don't have value as a human being. I am great at other things. Like I was able to hold all of that, where society would tell you that there's something wrong with you, that there's absolutely something wrong with you. And I didn't go there, but I know for many people that's a reality that they're contending with, that they feel fundamentally damaged. There's different cultural expectations and norms about um, how one builds a family and if there should be any medical interventions. So I come from a big Portuguese family, and it's funny because at one point I thought, like, do I explain this to my mom? Is she even going to understand? Like, can she conceptualize what this means? I think she knows abstract in theory, like, people go through medical procedures to have to build their families, but this is like in some cultures, like this is not an open conversation. Some cultures, you're trying to build a family, it's celebrated. For other cultures, it's like, don't tell us your business. Tell us, if there's something that's actually happening. Don't tell us all the strife that you're going through. But I remember sitting with like, how do I tell her? How do I explain to her? And I just kind of said like, yeah, I'm going to go through this procedure. We're having a hard time. So this is our next step. And she was like, okay, do whatever you got to do. And for my family and our culture, that was probably the most loving thing she could say. And all she said was, okay, do whatever you have to do. Do whatever you have to do to have your family, whatever that looks like for you. So it's going to be different in every culture and every group and subgroup, and every family has its own subculture. But there are definitely these expectations and these norms that we don't easily fall into, and that we have to shift that mindset of there are many ways to grow a family. There are many ways to enter into parenthood, motherhood, that there's no wrong way to do it. There's no right way to do it. Every way is valid. Whatever is right for you and your family. You are allowed to make decisions that are right for you and your family. Bottom line, nobody has to like it, approve of it. If you want that support, if you don't want that support, and that's something that I work with clients as well. Who is part of your story? Who is part of your village that deserves to know your story? Not everybody is going to deserve access to that information. Not everybody wants access to that information. And depending on your relationships based on history, you will have information, you will have data on, is this someone that I can trust with this information? Is this someone who's going to give me what I need? Because there are some people, whether we like it or not, who just can't do it. They just can't do that for us. And we can accept that, right? Like I know ahead of time that this person is not going to be that cheerleader that I want, or this person, is going to have judgments. And, I don't need to share that information. So that's part of the expectations, and whether it's your own culture, your own family, your own friend group, whatever, even geographical area, East Coast versus West Coast. I mean, it can be very, very different in terms of how you experience this journey.
Yeah, this is, it's such a vulnerable population. The folks that you work with, the folks that we work with, just people that are trying to build their family in different ways, who have often already experienced multiple losses. So, the one thing we know is that oftentimes an individual trying to get pregnant needs to experience multiple losses before a doctor will even refer her to go get a blood work panel or to try to figure out a deeper root cause of what's going on. Often, when individuals come with us to look into adoption as an option, it's after years and years of challenges and deciding that emotionally they need a different route to build
Mhm.
their family. And so my question for you is, really what ethical considerations should providers, anybody working with folks who are experiencing fertility challenges, what ethical considerations should those providers keep in mind when working with those individuals and talking about, family building?
I think first things first is the education and training. It should be standard for everyone working in the healthcare, everyone working in mental health. Again, I had zero training on reproductive mental health, perinatal mental health, all of that. So that would be a great place to start. If this is not something that you have had as part of your training, at least take some continuing education courses, some training just to familiarize yourself, because if you're working with people, you're going to work with families, you're going to work with folks building their families who experience to experience challenges. So that should be a basic ethical beginning for us. And also building your network for folks who can address the mental health of the families that you're supporting, of the people that you're supporting, so that they don't have to do all the legwork on their own. So if you have a social worker who specializes in reproductive mental health, if you have a trauma-informed OBGYN, if you have, a midwife practice, whatever it may be, having this be a part of everyone's network is an ethical decision that's important for all of our systems of care, for anyone specifically in the mental health space. So again, continuing education is going to be really important, and also not being afraid to say, I think you need more support than I can offer you right now. And that's okay. That's the most loving and ethical thing that you can do for your client. What some people don't know is that you can continue doing the amazing work that you're doing with the client, whether it's supporting through anxiety, through trauma, through OCD, whatever it is, and they can get more specialized care for reproductive mental health. As long as it's medically necessary, which it is, insurance should cover it. So that's something that I wish more people knew, is that, one, you can make that ethical referral, and two, you can actually do both.
Yeah, I'm curious if are there certain things that you see that I'm going to have to refer out? This is something that is different than what I am able to help with. Are there things that you see where that clicks for you and I need to make another referral here?
So absolutely for couples and families. So if there's something within the family system, within the couple, because ethically, if I'm seeing the individual, I'm not going to see the couple, and that's outside my scope anyway. If there's something like OCD, so if it's some mild OCD that we can challenge together, then that's something that we can do. But it may cross a threshold where I think you need exposure and response prevention treatment, something like ERP, or maybe there's EMDR that would be helpful during this time, because, another misconception is that building your family is always a happy time. It can absolutely be traumatic, especially for folks who are struggling with fertility. Absolutely traumatic, whether it's a small T or a big T. And so referring to someone for trauma processing, EMDR, can be really, really helpful. And also medication, of course, that would be an ethical referral, something that I know that is outside my scope of practice.
I think Nicole and I are both just interested. This is a question we love to ask everybody and for you in particular, what are your hopes for the future? And for you, that would be the future of reproductive, mental health care. And are there areas that I'm sure there's areas you feel still need more attention and more resources and more education, but what would your hopes be for this field moving forward in the future? What would you love to see?
I would love to see more support, more education, more conversations. And I think, because of my pocket of the internet and what I do, I see these conversations all the time. And I also have to hold that there are so many parts of the internet, social media, so many parts of healthcare and mental health care that are not having these conversations. And my hope is that every person who is in a helping profession, whether it's mental health, counseling, psychiatry, OBGYN, medical school, that they all have a basic understanding of reproductive mental health. This is over half your population, right? If we're supporting women folks who are assigned female at birth. We are supporting families. That's all of your population, essentially. If you're supporting, parents and, individuals, families, I mean, this is going to affect every profession. And it's important that we all have, even a foundational knowledge and training to best support people as they're going through it. My hope is that it's not a taboo topic. I know for me and for others, once you start talking about it, people will chime in and they say, oh yeah, I went to this clinic. Oh yeah, I had that doctor. And then we have these open conversations, and like, what a breath of fresh air. So I wish there's more of that.
I think that's a lot of what we wish for the adoption community as well, right? It's just the
Mhm.
conversations, and folks always say to us, once they're in the adoption community, they don't realize how large it is because it's
Mhm.
not widely talked about if you're not already a member of that community. And that just becomes so helpful to have your village behind you and the people that understand the experiences you're going through and can have those conversations with you about how beautiful it is and how hard it can be at the same time. And thinking about family and friends, other professionals, just people that might be in your life, what do you wish more people knew or understood about the experience of fertility struggles?
As I mentioned before, I think what a lot of people don't realize is that for a lot of folks, this really is traumatic. It's a traumatic experience. The loss, the devastation, the grief, again, that fight or flight constantly, and a lot of numbing, disconnection, dissociation. I mean, truthfully, if I sit here right now and think about my fertility journey, it's not all succinct, clear, linear process. There are holes there because I was in fight or flight for so long. The nervous system is dysregulated. It can absolutely be devastating and wonderful and beautiful and, really impactful. And again, it doesn't end once you have that family. That this continues to be a part of your journey, whether you're looking at your miracle baby or whether you see someone else struggling and you're like, gosh, I was there. I remember what that's like. All of that just continues to stay with you. Or even, the parts that people don't talk about where it would have been that child's first birthday, that loss that you had, where it would have been kindergarten graduation. We remember all of those things and we hold on to them. And, I think that's something that I wish people understood, is that it doesn't just have the happy ending that you may want or that you may hope for, that this is part of your journey forever.
Right. It doesn't just stay in this period of time, it's continual.
So grief is a continuum where, grieving this process and these challenges is a lifelong experience for anybody in all sorts of different ways. But here we're specifically talking about fertility struggles. What advice would you have for prospective adoptive parents that, okay, we're choosing adoption as our family building? Is there a point in time where that grief becomes appropriate for making those big decisions and putting a pause on fertility treatments and moving forward with another option? Do you have any advice for us as we talk to people that are going through the different ups and downs of that?
Mhm. I think for a lot of folks, I would support their empowered decisions regardless, right? Because these are not things that we go into very lightly. These are not usually impulsive decisions. We have thought about them, thought about them with great detail, discussed them internally, externally. I know some people who say, like, I just can't do another round of IVF. Like, I can't do X, Y, and Z anymore. It's time to move forward. And yes, that's grief, and that grief is going to move through you and with you throughout time. And there's acceptance. So I want to honor that decision and sit with the acceptance as well, because, as I mentioned before, you're allowed to make whatever decisions are right for you and your family. And as long as it's coming from that centered place. So normally I guide folks through an exercise. We're tapping into logic and reasoning, we're tapping into our emotion, and then coming to that wise mind decision of what's truly in your best interest that withstands the test of time. Because those wise mind decisions are not impulsive decisions. You've gathered the data. And as I said, they withstand the test of time. So you're not going to look back 5, 10 years and say, I really wish we hadn't done that. They are consistent with your goals and your values. So if you can tap into that and, come to that answer and that acceptance, like, that's what that acceptance is all about. There'll still be grief there because I'm sure it wasn't your first choice. It probably wasn't your fifth choice. And this is your reality, that reality acceptance of, this is how we're going to move forward. This is how we're going to move forward with our family planning. And also that there's no absolute right answer, there's no absolute wrong answer, there's no absolutes in anything. That, you're making the best decision for you and your family at this moment in time with all of the information that you have.
Thank you so very much. We
Welcome.
appreciate you being here with us and educating us and also showing us what is helpful, and that everybody needs education on many different things, but this affects so many people, and we want to make sure that we're appropriately referring. And I love the always refer, always refer. We believe in that, and we want people to have resources. So we really appreciate you being here with us today.
Of course. I love this conversation. Thank you.
Dr. Nancy Grechko, thank you so much for being here with us today, allowing us to ask these questions and to learn more, because it's so important that we keep educating ourselves, and hopefully this was educational for our listeners as well. Do you have parting thoughts? Anything else that you want to leave with our listeners today?
My parting thoughts are you're not alone. I tell people all the time, there are over 7 billion people in this world. You are never literally alone at anything, right? Like that's statistically impossible. You are not alone. You have to find your people. And those people will support you. Those people who get it, even if they don't get it, they're going to support you anyway. Find your people, and it'll allow you to feel more empowered in this journey, whether that's getting you a Starbucks gift card or planning play dates so that you can take care of yourself and the kids are, playing with their friends. Every little action of love really supports your journey. And those people, they truly are out there. Whether they're strangers right now and soon to be friends, they're out there.
What an incredible and honest conversation we've been able to have today. Nicole, what are some of your parting thoughts from everything we've spoken about?
It was definitely powerful, and something that, unless you're going through it, I think it's hard to understand. So it's really nice to have empathy, but also from empathy from somebody who has been through it. So Dr. Greco offers great resources for families. This really opens my eyes as an adoption counselor throughout the years of, I've worked with many families who have gone through fertility struggles and suffered severe things of what I would consider to be maybe less severe, but that doesn't matter. It doesn't matter. Going through a fertility struggle in general is severe enough to warrant getting help, getting resources, because that pain, I can't imagine it. And I want to be there for families with it. And so learning more, I like how Dr. Greco said that, like, she wants people across all different areas to understand fertility struggles and how that impacts families. But I think definitely as adoption counselors, that is something that needs to be understood too. Sometimes we come, as Dr. Greco said too, after people have already considered their options and their grief and everything. But I think it calls light to, during our home study process and our evaluation process, making sure that we honor and empathize with families who have been through these struggles. What about you, Elise?
Yeah, I mean, we discussed so much, and I think my main takeaway is hopefully people are able to know when it's time to seek help, right? Fertility struggles are taxing, emotionally, physically, all around. They can be overwhelming and taxing, and you have to know when it's time to reach out to somebody else for a little bit more support. And, Nicole, like you said, when folks come to us hoping to adopt, we want it to be their plan A. And often, in order to get there, they have to do a lot of self work first. And we love when we have people come to us that have said, we've been in counseling so that we can work through the grief and loss that we've felt through our fertility struggles. That's how we know somebody's really ready, when they've put in that work. And so I think we say all the time, there's always a point in everybody's life where some counseling would be beneficial, and you just have to be able to know when that is, and know that there's a community and a network out there to support you, and that there's never any shame in saying, I need a little extra help. We have all been there at some point in our lives, and if we haven't, we will be one day. And so to know that there's resources and most importantly, be willing to access them is so important. This brings us to the end of today's episode. A huge thank you to Dr. Nancy Grechko for joining us and sharing not only her own clinical expertise, but her personal experiences as well with her own fertility struggles. With such honesty and such care, we so appreciate her being here with us.
Fertility and family growing is such a complex emotional journey, and today's conversation really highlighted how powerful it can be when professionals bring both heart and knowledge into the work that they do. We really hope it resonated with some of you listening.
Thank you so much for tuning in. Don't forget to follow us on your favorite podcast platform, leave a review, and share this episode with somebody who might need to hear it.
We will see you next time on Adoption and Beyond.